Danny the dropout. That's what they called her in the break room when she wasn't listening, and sometimes when she was. Dr. Gerald Ashford had heard it 3 times in 2 weeks, each time followed by nervous laughter that died the moment anyone senior walked past. He'd never corrected them. He'd never had to. The name did his work for him, spreading through Oak Creek Memorial like a stain that wouldn't wash out, a reminder to everyone on staff that some people didn't belong in white coats or scrubs, didn't deserve the credential of competence, didn't merit questions about their past because their past clearly wasn't worth asking about. She didn't know he'd created it. That was the beauty of it. Danielle Ross moved through the night shift corridors of Oak Creek Memorial in Jacksonville with the precise efficiency of someone who had learned, over 3 years, to make herself smaller with each passing month. Her steps were soundless on the polished tile floors. Her scrubs, always perfectly creased, the sleeves folded exactly 3 times, whispered against her sides like an apology for occupying space. The fluorescent lights above cast shadows under her eyes that belonged to exhaustion or perhaps to something much older, something that had calcified into the set line of her jaw. She did not make eye contact with the day shift nurses as they passed. She did not linger by the medication cart. She did not smile at the residents who sometimes stopped her with patient questions. Invisibility was a skill, and she had become expert at it. Room 314 was on her route 3 times per shift, standard vitals rounds, nothing unusual, nothing that would draw attention. The Navy SEAL recovering in that bed had triggered every alarm in her nervous system the first time she saw his name on the assignment sheet, and she had considered calling in sick. She had sat in her car for 40 minutes that morning, hands gripping the steering wheel, breathing the way they had taught her in the mountains of Kandahar province. Then she had walked into the hospital because walking away would be worse, because drawing attention was the one thing she could not afford, because some people simply had to be endured in silence. The SEAL's recovery was progressing according to standard post-surgical metrics. His incision was healing with minimal inflammation. His oxygen saturation held steady at 96%. His pain was managed with a careful rotation of analgesics that kept him comfortable without the drowsiness that would interfere with his physical therapy. Danielle assessed these metrics with the focused precision of someone whose hands knew exactly where to find a pulse, 1.2 seconds to locate, another 2 seconds to count the beats, the rhythm catalogued and filed away in the part of her brain that had never quite stopped running combat calculations. Her fingers were steady on his wrist. Her breathing was measured. The tremor that wanted to start in her shoulders never reached her arms. When she left the room, the SEAL's eyes had opened briefly. Recognition flickered across his face like a match striking in darkness, and his jaw had tightened. She saw shame move through his body the way physical pain moves through broken bones. She had kept walking, her clipboard cradled against her chest, her eyes fixed on the doorframe ahead. Some acknowledgments were too dangerous. Some conversations existed only in the testimony she had given in a closed courtroom 3 years ago in a building she no longer allowed herself to think about. The court-martial had taken 47 minutes. The consequences had taken everything else. The supply closet smelled like bleach and the sharp, chemical undertone of sterilization solution. Danielle inventoried chest tubes with a focus that bordered on meditative, her fingers running across the cardboard boxes, checking counts, documenting quantities on the clipboard with precise notation. The mundane mathematics of hospital logistics, how many tubes remained, how many would be used in the next 24 hours, how many orders needed to be placed, quieted the louder thoughts. The part of her that had been trained to operate in sandstorms under fire found comfort in small, solvable problems. This many tubes. This many orders. This many hours until shift change. A scar traced her right hand, running from her knuckle to her wrist, surgical and precise. Another scar ran along her collarbone, visible when her scrub shifted during movement, another reminder of the body's capacity to survive what it was never supposed to survive. The scars told stories she would not tell. The calluses on her palms, built from climbing rope, from carrying weight that would break most people, from holding lives together in conditions where technology had failed, were at odds with the rest of her body, which had been deliberately softened, deliberately diminished, deliberately rendered invisible. She wore her invisibility like a uniform. The supply closet door opened behind her. She did not turn. She did not need to. The presence that filled the small space carried its own weight, its own gravity, the unmistakable pressure of a man who had decided, long ago, that other people existed for the purpose of reflecting his importance back to him. Dr. Gerald Ashford entered as if the closet had been arranged specifically for his arrival. The door clicked shut. He was tall, with the kind of build that came from calculated gym sessions rather than genuine exertion, the muscles of vanity rather than function. His hair was precisely colored to hide gray. His watch was a Rolex that cost more than most people's cars. His voice, when he spoke, carried the tone of someone accustomed to being obeyed immediately. Still counting tubes. His words fell into the space between them like stones into still water. He stood close enough that she could smell his cologne, something expensive and chemical, cutting through the antiseptic air. You know, I've been looking at your evaluations from your previous positions. Danielle's hands continued their work. Chest tubes remained chest tubes. Numbers remained numbers. The clipboard remained exactly where it had been, and her eyes remained fixed on inventory rows that suddenly seemed more interesting than anything that might appear in her peripheral vision. Interesting gaps, Ashford continued. 3 years of nursing experience, all documented. But before that, he paused, letting silence accumulate. Nothing. No references anyone's willing to verify. No clinical rotations listed. No prior facilities sending records. It's almost like you didn't exist before you showed up here. He moved closer. His presence made the air pressure change. Almost like someone wants that gap to stay empty. The tremor that wanted to start in her shoulders did not reach her arms. The breath she took was measured, clinical, the kind of breath that had kept her alive in contexts he could never imagine. She turned to face him, her eyes carefully neutral, her expression the practiced blankness of someone who had learned that any reaction was a vulnerability. The board's been asking questions, he said, his smile spreading like an infection. Surgical outcomes. Mortality rates. Staffing decisions. His eyes moved across her face like hands searching for something to break. They think I'm not managing my people effectively. They think maybe my judgment's compromised when it comes to hiring, to evaluations, to who belongs on my floor and who doesn't. He stepped even closer. His voice dropped lower. I need to remind them who actually controls things here. Who makes the decisions? Who decides who stays and who disappears? She did not blink. She did not step back. The inventory clipboard remained exactly where it had been in her hands. When she spoke, her voice carried the careful, measured quality of someone choosing words with surgical precision. I can finish this tomorrow, doctor. If you need the supply closet. You're not listening. Ashford's smile tightened. His hand reached out, and for a moment she thought he would touch her shoulder, would cross a line that would require response. He didn't quite. He stopped just short, his fingers hovering in the space between them like a threat. I think you need to understand something. Your position here is contingent. Dependent on my continued goodwill. The evaluations. The references. The clinical privileges that keep you employed. His voice was softer now, more dangerous. People with no history, no connections, no one who knows anything about them, those people are disposable. She looked at his hovering hand, then back at his face. Her jaw moved, just slightly, the way a muscle moves when it's been held too long in tension. Am I dismissed, doctor? He withdrew his hand. His smile became something crueler. For now. She watched him leave. The supply closet door closed behind him, and the bleach smell seemed to sharpen. Danielle remained still for exactly 37 seconds, the way a predator remains still after prey has passed, the way silence itself can be a form of survival. Then she returned to her inventory, her fingers moving across boxes with mechanical precision, her mind somewhere else entirely. In her locker, locker 247, tucked in the back corner of the night shift break room where few people ventured, her jacket hung with everything else. The jacket was old, the fabric worn soft from years of use, the color faded from deep green to something closer to sage. She had brought it with her 3 years ago and had never quite managed to throw it away. Inside the lining, sewn carefully with stitches only someone with surgical hands could have made, was a patch. The 75th Ranger patch, faded and worn, the edges softened from time and handling. Next to it, stitched with the same precision, was the major rank insignia. Hidden. Not destroyed. Not abandoned. Just waiting, the way some parts of a person wait in darkness for the moment when they might be called back into service. Danielle did not open her locker that night. She did not touch the jacket. But she knew it was there, the way she always knew. The way a person who had learned to survive in contexts most people could not imagine always knew where her exit route was, always knew where her past was hidden, always knew exactly what she had been before she became this smaller, quieter version of herself. The board was asking questions about Dr. Ashford's judgment. The seal in room 314 was recovering according to protocol. And somewhere in the Jacksonville night, the fluorescent lights hummed their monotonous song, and she continued her work. The chart in room 209 told the story in 2 different handwritings. Danielle noticed it the way she noticed everything now, details that didn't belong, gaps that shouldn't exist, the kind of professional erasure she recognized because she'd learned to make herself invisible in the same way. The post-op sepsis protocol had been reversed. The original antibiotic order, written in clear surgical notation at 1402, had been crossed out and rewritten at 1623 in Dr. Ashford's hand. The timestamps didn't match the patient's fever spike. Nothing matched except the deliberate attempts to hide something catastrophic, a delayed antibiotic on a surgical site infection that Ashford had missed during rounds, now reframed as nurse error on the documentation. The patient, a 64-year-old construction foreman, was holding stable only because his body was strong and her interventions had caught the deterioration before septic shock took him. She photographed the original chart with her phone, the camera flash casting a brief rectangle of light across the falsified numbers. Her hands were steady. Her breathing was steady. But somewhere in her chest, the major who'd led men through Sangin was doing calculations about institutional betrayal and the price of silence. Dr. Ashford's reflection appeared in the computer monitor before she heard his footsteps. He'd been watching from the doorway for approximately 7 seconds. She knew because she'd counted. His eyes locked onto the phone in her hand with the precision of a man recognizing a threat, and something shifted in the hallway. The air pressure changed in a way that made her skin prickle with the memory of ambient danger. He didn't speak. He didn't have to. The message was already being written. 40 minutes later, the overhead paging system crackled across all 4 floors of Oak Creek Memorial, the speakers mounted in every hallway and room broadcasting with deliberate clarity. Nurse Danny the Dropout to administration. Danny the Dropout, your performance review is waiting. The voice was administrative, official, unremarkable. That was what made it lethal. The cafeteria went quiet at 15:14. She was restocking supplies on the cardiac floor when the second page echoed through the speakers at 15:16, and this time she felt the weight of 18 staff members' eyes finding her simultaneously. One measured breath. She continued placing gauze packages in precise rows, 4x4, sterile wrapped, medical precision disguised as routine work. But a single tear traced her cheekbone, cold and unbidden, a physical betrayal she hadn't authorized. She wiped it without breaking stride, without looking up, without giving him the satisfaction of her face. Her jaw clenched hard enough to hurt. By 15:43, the entire hospital had heard the page. By 4 p.m., the nickname had traveled through 3 separate departments like a contagion. Danny the Dropout. The words carried weight because they were designed to. They referenced a discharge that the file called medical, that the rumors called criminal, that nobody had actually verified. They were true enough to sting and false enough to be unsourced, which made them perfect ammunition in an institution where reputation was currency and whispers were capital. The supply closet ambush came on day 2. She was collecting for tubing at 14:22 when Ashford blocked the doorway, his frame filling the narrow space with deliberate occupation. He stood close enough that stepping backward would require acknowledgement of threat, close enough that the cologne he wore, something expensive and territorial, probably $500 a bottle, made the air taste metallic. His smile had the quality of a predator showing teeth, and his voice dropped to the register of absolute certainty. You're going to delete that photo, and then you're going to understand something about how this hospital works. I've buried better nurses than you for less. Stronger ones. Older ones. By month's end, you'll be scrubbing bedpans in the long-term care wing, and you'll thank me for letting you keep that much. She met his eyes with absolute stillness. One measured breath filled her lungs like preparation. When she spoke, her voice came out level, not deferential, not defensive, something else entirely, something that made him blink first even though he maintained the physical advantage. I've survived worse than you, doctor. I just hoped I wouldn't have to do it twice in one lifetime. The words carried weight because they were true in ways he could never fully understand, and his smile froze for exactly 2 seconds before reasserting itself. But something had shifted. He'd glimpsed something in her composure that didn't match the timid nurse who'd folded her hands in the hallway after the overhead page. He'd seen the outline of something dangerous beneath the surface, and it made him angry in a way that transcended professional rivalry. Anger was good for him. Anger made him careless. Day 3 arrived like judgment. The parking lot at 7 o'clock, shift change where day and night teams crossed like tidal movements, where the chlorine and antiseptic smell of hospital work gave way to diesel exhaust and the aggressive brightness of early morning sun. Ashford positioned himself on the asphalt with geometric precision, waiting for her emergence from the night shift exodus. When she appeared, moving through the crowd of nurses and residents with the invisibility she'd perfected, he intercepted her directly. His voice pitched to carry across the entire group, 23 staff members within audible range, young nurses and senior RNs and residents whose futures depended on his recommendations. Effective immediately, Ross is being moved to permanent night shift. Seems she's more comfortable in the dark, away from real medical professionals. Performance concerns. Security will update her access badge within the hour. The announcement fell like a gavel. One of the younger nurses, a recent graduate named Sarah from Tampa, started to object, her voice rising in protest, but Ashford's gaze shifted toward her with surgical precision, and the objection died before it formed. The rest of the staff stood frozen, caught between empathy and self-preservation. Danielle took one measured breath. The humiliation was calculated to destroy her invisibility, to transform her from overlooked to publicly diminished, to ensure that every interaction going forward would reference this moment, this public judgment. Her entire team watched as she processed the words, and she did something that surprised even herself. She asked the only question that mattered, her voice carrying the kind of calm that came from having nothing left to lose. "What time should I report, doctor?" The politeness in her voice made it worse somehow. It made her seem smaller, more defeated, more complicit in her own erasure. The major was gone. The invisible nurse remained. She walked to her car at 7:04 with perfect posture, shoulders back, head level, the bearing of someone who'd learned to carry impossible weight. Her key slid into the ignition with practiced precision. The engine turned over. And then, in the sealed privacy of the driver's seat, with the doors locked and the parking lot shrinking in her mirrors, her hands began to shake against the steering wheel. 10 seconds. She allowed herself exactly 10 seconds of trembling, the physical release of everything she'd contained across 3 days of calculated humiliation. 10 seconds of being human instead of functional. Then she gripped the steering wheel, inhaled until her lungs burned, and drove toward the night shift that would anchor her invisibility even deeper. But that wasn't the worst part. The worst part was that somewhere in his office, Dr. Ashford was already making calls, already escalating, already preparing the next phase of his campaign. He'd seen her restraint and interpreted it not as strength but as confirmation of her vulnerability. He'd mistaken her composure for submission. And that mistake would become the trajectory that changed everything. The night shift at Oak Creek Memorial operated on skeleton crew staffing, 1 resident on call, 3 nurses covering for floors, the building reduced to essential functions and the kind of quiet that exists only in hospitals after midnight. Danielle worked the ICU alone, moving through corridors lit only by monitor glow and emergency strips, her scrubs pale in the darkness like a ghost haunting her own professional dissolution. Room 314 was her responsibility. The SEAL named Lieutenant Marcus Webb. The man who'd testified. The man she'd avoided making eye contact with for 3 years. The man whose decision had ended her career, and whom she'd just saved anyway because that's what you did when someone was dying, regardless of what they'd taken from you. The professional code superseded the personal cost. Always. At 2:14, the monitor alarm started as a soft chime. Then it escalated. Room 314's O2 saturation began climbing the wrong direction, 94%, 88%, 82% in the span of 40 seconds. Danielle moved before conscious thought, her feet already crossing the threshold. Webb was sitting upright, gasping, his lips already dusky, his breathing rapid and shallow, his right chest completely motionless while the left heaved desperately for compensation. Tension pneumothorax. His collapsed lung pressing inward, air filling his thorax cavity, crushing his heart with the physics of suffocation. The body's own pressure destroying itself. 3 minutes. She had approximately 3 minutes before cardiac arrest. The on-call resident arrived at 2:17, a third-year named Chen who froze solid the moment he recognized the clinical picture. His hands trembled as he pulled out his phone. "We need Dr. Ashford. We need authorization for chest decompression. I can't, I've never done this outside simulation. Page him." "I did." No response. "Page again." The monitor alarm screamed its mechanical panic into the darkness. Webb saturation hit 76%. His eyes found hers across the distance of the small room, and something unspoken passed between them. Recognition, true recognition, the way you see another human being when death is negotiating the terms of entry. His expression carried 3 years of regret, 3 years of knowing what his testimony had cost, and in that moment, his eyes asked forgiveness that she hadn't known he was seeking. More significantly, his eyes conveyed the exact moment he stopped fighting. He was accepting it. Accepting that death was payment. That this was how it ended, not in combat but in an ICU bed with the woman he'd helped destroy standing witness to his surrender. Chen backed toward the wall, phone still in hand, waiting for authorization that wouldn't come. "You can't. You're not authorized. Ashford will." The care package sat on the chair beside Webb's bed, a gift from a visiting Marine buddy, standard issue comfort from someone who'd understood the weight of combat recovery. Standard MRE packaging, vacuum sealed, the kind of thick plastic wrapping designed to preserve meals through desert heat and tactical extraction. Danielle's hands moved before her conscious mind decided. She didn't think. She didn't calculate. The muscle memory overrode 3 years of civilian restraint, of being nobody, of being invisible. She tore the package open. The sound was sharp, the plastic tearing like a specific punctuation. Her fingers found the thick sealed edge, her movements precise because they were old, because this was muscle memory written into her nervous system in dust storms and blood, in Sangin where she'd learned that hands steady enough to save lives were hands steady enough to do anything. One measured breath. The MRE package tore free. She improvised what she needed, sealed plastic, the kind that held pressure, the kind that could function as an occlusive seal against the pneumothorax. "What are you doing?" Chen's voice came from the corner where he'd retreated. She didn't answer. She was already moving, already positioning, her hands finding the second intercostal space, mid-clavicular line, the anatomical landmark imprinted on her body like a map she'd traveled 1,000 times before this hospital, before this uniform, when she was something else entirely. The needle went in clean. Second intercostal space, mid-clavicular line. The anatomical landmarks lived in her hands the way some people carried prayer, muscle memory made flesh. Webb's lung had collapsed like a failed parachute. The tension pneumothorax was pushing his heart sideways, crushing the vessels, stealing the oxygen that kept a Navy SEAL alive. At 0200 hours on a Tuesday morning, Oak Creek Memorial was running on fumes, one resident frozen solid in the doorway, 3 nurses covering for floors, and Danielle moving through the pre-dawn darkness like she'd been born in it. The MRE package was still on the bedside table. A visiting Marine had left it 3 days ago. She'd planned to throw it away. Now she was taping it over the needle puncture site, fashioning a one-way valve from plastic packaging and medical tape, the kind of improvisation that lived in the space between desperation and precision. The hiss of escaping air sounded like relief. Webb's color began its shift almost immediately, that transition from dusky blue to something closer to human. His chest rose. Actually rose. The ventilator's rhythm synchronized with his own breathing, no longer fighting against a collapsed lung. She didn't speak. She didn't celebrate. She watched the monitor like it was the only language that mattered. The pulse oximeter climbed, 68%. 71%. 75%. The resident, a man named Chen who'd been in Jacksonville for 6 weeks and still looked terrified by everything, stood in the doorway with his mouth open. His hands trembled. Not composure. Not training. Just the raw panic of a young doctor who'd been taught what to do in textbooks and was discovering that textbooks didn't prepare you for the moment when a human being stopped breathing and the only thing standing between them and death was a crashed computer in a white coat and a nurse with hands that belonged to another life entirely. "Get me a 14-gauge needle from the crash cart," Danielle said. Not a request. An order. The kind of voice that comes from someone who's given orders in dust storms and watched them obeyed because the alternative was body bags. Chen didn't move. She pivoted without waiting. The crash cart was 3 steps away. Her fingers found the needle, 14 gauge, gleaming under the fluorescent lights that hummed like trapped insects, and returned to the bedside in movements so economical they looked like choreography. She positioned the needle at the same intercostal space, perpendicular to the chest wall, above the rib to avoid the neurovascular bundle that ran beneath each rib like copper wiring in a wall. The needle advanced. She felt the give when it breached the pleural space, that small pop of resistant surrendering, and the rush of air escaped like a sigh of relief. Pain was information. Pain was data. The lack of pain now meant she'd done it correctly. The anatomy had given her its permission. Webb saturation numbers climbed again, 78%. 81%. 85%. His blood pressure steadied. The monitor's rhythm, that jittery desperation that had been burning across the screen, began to settle into something resembling normal sinus rhythm. Not perfect. Not peaceful. But viable. Alive. 7 minutes. That's all it had taken to pull a man back from the edge of death. 7 minutes and hands that remembered when this wasn't called practicing medicine without a license. It was called field surgery. It was called staying alive. The color in Webb's face deepened. Not the dull blue of hypoxia anymore, but the pale pink of someone whose brain was getting oxygen again, whose body was remembering how to survive. Danielle adjusted the ventilator settings, monitored the chest wall expansion, checked the tube placement one final time. Everything was holding. "Call respiratory therapy," she said to Chen, her voice dropping an octave the way it did when the orders mattered. "Get a chest tube kit ready for when Dr. Ashford arrives. Document the timeline exactly as it happened." Chen nodded like a man waking from a nightmare. He was already moving toward the phone when Ashford appeared in the doorway. The chief of surgery did not look like he'd been asleep. He was wearing pressed slacks and a cashmere sweater that cost more than Danielle's entire week of wages. His hair was perfect. His expression was something between annoyance and calculation, the way a man looks when something has interrupted his night and he's already planning how to weaponize the interruption. He examined Webb with the careful precision of someone who'd been trained to notice everything except his own limitations. The improvised MRE chest seal. The successful decompression. The stabilized vitals. The color returning to a man's face. He stood there for nearly a minute, silent, his eyes moving from the patient to the equipment to Danielle and back again. "Who authorized this procedure?" His voice was conversational. That was worse than anger. Anger would have been honest. "He would have died," Chen said quietly. "She saved his life. He would have." "I asked who authorized it," Ashford said, and his smile never reached his eyes. It was the smile of a man who'd just realized he'd been handed a weapon and was already planning which way to point it. Nurse Ross performed an invasive procedure without physician authorization. That's practicing medicine without a license. The silence that followed was the kind that moves through a room like weather. Danielle could hear the ventilator breathing for Webb. Could hear the monitor's steady beep. Could hear her own heartbeat, which was exactly the same rhythm it would have been if she'd been standing in a dust storm watching a convoy disappear into a wadi. She didn't defend herself. She didn't explain. She didn't point out that the patient would be dead without her hands, that the law and the textbooks and the licensing boards all meant nothing next to the fact of Webb's heartbeat continuing forward. Ashford was already pulling out his phone, photographing the MRE packaging, the chart, the setup. Documenting. Building his case. "Get me his full file," he said to Chen. "And get me security footage from this wing." By 0600, when the day shift was arriving with coffee and small talk, Ashford had made 3 phone calls. Danielle didn't know to whom. She didn't need to. She'd seen how power worked in institutions. She'd seen what happened when a man who controlled the hospital decided you were expendable. By 0800, her supervisor, Marcus, the only person who'd actually vouched for her hiring, who'd believed her story about nursing school and fresh starts, was being reassigned to the satellite clinic in Baldwin, 30 miles away and entirely unable to intervene on her behalf. By 1000, security was reprogramming her badge. The ICU doors would no longer recognize her. She was being erased one access restriction at a time. By 1200, an incident report had materialized on the administrator's desk. It was thorough. It was damning. It cited her for dangerous practices beyond her scope, for unauthorized procedures, for putting a patient at risk through her reckless actions. Ashford had written it with the precision of someone who'd read a lot of legal documents and understood exactly which words would stick. By 1400, she was sitting in the HR office facing a woman named Patricia whose job was to read prepared statements without making eye contact. "Pending investigation into the events of last night, your employment is suspended effective immediately," Patricia said, her voice moving through the words like she was reading from a script someone else had written and she was deeply tired of speaking other people's lines. "How is Lieutenant Webb?" Danielle asked. Patricia blinked. The question had come from somewhere outside the script. "That's not relevant to this meeting." "It's the only thing that's relevant." One measured breath. The kind of breath that comes from deep practice, from years of staying still while everything around you moved toward destruction. "He's alive. His saturation levels are stable. The chest tube is functioning properly. The respiratory team said his prognosis is good." "Then we're done here," Danielle said. She turned in her badge at the security desk. The guard, a man named Robert who she'd exchanged pleasantries with every single night shift for 3 years, wouldn't meet her eyes. That small gesture of avoidance told her everything she needed to know about how thoroughly she'd been erased. Her locker was on the 3rd floor of the nurse's station. She moved through the corridors without looking at anyone, without acknowledging the people who'd worked beside her just hours earlier. The fluorescent lights buzzed their constant hum. The hospital smelled like antiseptic and old coffee and the particular staleness of a building that had been running 24/7 for decades without ever quite letting in fresh air. Inside her locker, beneath her street clothes and her phone charger, the faded 75th Ranger patch was still sewn into the jacket lining, hidden where it had been hidden for 3 years. A whisper of another life. A major's rank that no nurse had ever earned legitimately. A reminder that some people couldn't be broken because they'd already been broken in places so deep that institutional punishment looked like noise. She gathered her things. She didn't need much. She never did. But that wasn't the worst part. The worst part was walking past room 314 on the way out, seeing Webb through the open door, seeing him awake and breathing and alive because of her hands, and knowing that she would never be allowed to touch another patient here again. The doors to room 314 burst open at 0420 hours, and Dr. Gerald Ashford stood frozen in the threshold, his pristine white coat still smelling of the administrator's office where he'd been fielding calls about staffing shortages. His eyes moved from the monitor, sinus rhythm, 94 oxygen saturation, to the Navy SEAL sitting upright in the bed, chest tube draining clear fluid, breathing on his own. then to Danielle, standing at the bedside with her hand still steady, her jaw set in the particular way that meant she'd just done something extraordinary and was now waiting to be punished for it. 20 minutes. That's how long it had taken Ashford to respond to the overhead page. 20 minutes while Danielle's hands had moved on muscle memory she'd sworn to forget, while her voice had cut through the frozen resident's paralysis like a blade through silk. The chest seal improvised from an MRE package, a technique that belonged in a Helmand Province forward operating base, not in a Jacksonville civilian hospital. The needle decompression she'd performed with the precision of someone who'd done it before, in dust storms, under fire, with shrapnel still embedded near her spine. Ashford's face shifted. Not with gratitude. Not with recognition. With something far more dangerous, the realization that she'd stepped beyond the boundaries he'd drawn for her, that she'd revealed a competence that threatened his narrative of her as a failing, desperate woman grateful for whatever scraps of employment he left her. "You performed a procedure beyond your scope," he said quietly. His voice carried the controlled precision of a man who'd practiced this speech. The resident was present. "There's documentation that will need to be addressed." Danielle didn't respond. She simply released the bedrail and stepped back, her movements clean and efficient, a nurse returning to proper hierarchy. But her eyes met his with the flatness of someone who'd already calculated that this was finished, that his fear had just written her termination before the sun came up. Ashford left the room. He didn't return to his office. Instead, he made 3 phone calls before dawn broke over Jacksonville. The first call went to Marcus Chen, the chief nursing officer, at 0437 hours. Ashford's voice was controlled, almost apologetic. "We have a significant scope violation on the night shift." The nurse in question performed advanced procedures without physician supervision. "I'm concerned about liability. I think it would be prudent to restrict her access to the ICU effective immediately and begin formal documentation for termination proceedings." The second call, at 0451 hours, went to Roland Hibbs, the hospital administrator. Ashford framed it differently: "The incident report I filed yesterday on the sepsis protocol. The nurse responsible may have been attempting to cover her own mistakes through unsupervised interventions. I think we need to escalate this to risk management. The board will want to know we acted decisively." The third call, at 0506 hours, went to Derek Walsh, Danielle's direct supervisor, who'd been at Oak Creek Memorial for 11 years and was one of the few staff members who'd shown her consistent kindness. "Derek, we need to have a conversation about your nurse. I'm not going to throw her under the bus, but I've been asked to report some serious concerns, and I think the best thing for everyone, including her, is if she's reassigned to the satellite clinic in St. Augustine effective immediately. It gets her away from the scrutiny. It's actually merciful, when you think about it." By 0800 hours, Derek Walsh was driving to the St. Augustine Medical Center 45 minutes south with a transfer letter in his pocket that listed no reason beyond administrative reassignment. He was removed from her life as completely as if he'd vanished into the Atlantic. At 0930, the incident report was amended. Danielle's handwriting wasn't on the original. Ashford had filed his observations as the attending surgeon, but now additional notes appeared in the hospital's electronic system under his signature. Nurse demonstrated disorientation regarding proper protocol. Contaminated field noted. Resident corrected multiple errors in real time. Recommend immediate review of all night shift decisions pending investigation. None of it was true. All of it was documented. That was Ashford's genius. He didn't shout or threaten anymore. He simply wrote things down, built architecture around her culpability, made her guilt into a structure that would be difficult to argue against because it existed in triplicate in the hospital's records. At 1100 hours, Security Chief James Marino appeared at the ICU entrance with Danielle's badge and a sheet of paper. His expression was carefully neutral, the look of a man doing a job he didn't entirely understand. "Effective immediately, your access to the ICU is restricted pending investigation. Your regular floors are still available, but you'll need to escort badge someone if you need to enter critical care areas." He handed her the paperwork. "It's administrative. Nothing personal." Everything was personal. Everything was a knife, just wielded with the precision of institutional process instead of actual violence. Danielle took the badge and the paperwork and nodded. She thanked him. She did not cry. She did not argue. She did not call Derek, who could no longer help her. She simply existed in the narrow space between compliance and survival, the way she'd learned to exist 3 years ago when the courts had decided that telling the truth about Sangin was a court-martial offense. By 1400 hours, she'd requested the rest of the shift off, citing the stress of the investigation, and walked to the basement laundry room as if moving through water. The basement of Oak Creek Memorial smells like institutional bleach and detergent so strong it coats the back of the throat, like you're breathing in the physical manifestation of everything being cleaned away. The fluorescent lights buzz every 40 seconds with a sound like small insects dying. The industrial washers line one wall, their stainless steel surfaces reflecting the harsh white overhead lights. 3 sets of scrubs sat folded on the counter, her night shifts for the week that she'd bought with her own money because the hospital-issued ones never fit right. Blue, forest green, navy. She began folding them, and muscle memory took over, the same precision she'd once applied to dress blues, back when her hands were someone else's hands, back when she was someone else entirely. Bottom hem to waist. Waist to collar. Sleeves tucked with geometric precision so acute they could cut paper. The first set was easy. The repetition was meditative. The basement was empty except for the sound of ventilation and the occasional thud of a washing machine entering spin cycle. The second set. Her hands moved, but something fractured inside. She allowed herself, for the first time in 3 years, to remember Sangin in full detail. Not the version she'd testified about, not the version that had appeared in the court-martial transcript. The real version, the terror and the blood and the impossible calculus of 19-year-old Marines bleeding out in a street you'd walked into on bad intelligence, on contradictory intel that your commanding officer had overridden, on a decision you'd made that violated direct orders. Webb had been the first one she reached, a lance corporal with a femoral artery wound that would kill him in 8 minutes at that rate of blood loss. 3 others pinned down behind rubble, unable to move without catching sniper fire. Automatic weapons fire stitching patterns in the concrete. Her running through that fire in full kit with a medical pack, moving like something inhuman, like someone who'd already accepted that she would die in that street and the only variable was whether anyone else came with her. 17 hours of surgery in a field hospital with fragmenting vertebrae in her spine, 2 rounds of shrapnel lodged so close to her spinal cord that removing them risked paralysis. She'd performed the procedures anyway because the men would die otherwise, and then she'd collapsed, and then the infection had set in, and then the medical discharge that came with the understanding that she'd never have full strength again, that her hands would occasionally betray her with phantom pain, that her legs would give out on stairs without warning. The court-martial wasn't Webb's fault. He'd been asked a direct question, did Major Ross enter the kill zone against direct orders? He'd answered, yes, she did, and I owe my life to that decision. The JAG officers had heard, yes, she disobeyed, and written it down as a serious charge. Ashford didn't understand any of this. Ashford saw only that she'd exceeded her scope, that she'd acted without permission, that she was a threat to the hierarchy he'd constructed around himself. She folded the second set with shaking hands now, the composure finally cracking in the privacy of the basement where no one could see it. 1 tear fell on the blue fabric, then another, and she let them come because no one was watching, because the indignity of being erased twice, first by the court-martial system that had decided her sacrifice was insubordination, now by a man who didn't understand what he was destroying, had finally broken something that had held for 3 years. She'd saved Webb's life at great cost to her own. She'd saved him again 2 nights ago, when his lung collapsed and the on-call resident froze and her hands remembered exactly what to do, where to press, how to move. And for that, she was being destroyed a second time by a man whose entire career was built on altered charts and buried mistakes. The irony tasted like copper. Like blood that wasn't hers. The third set of scrubs. She finished folding them, her hand steadier now, the tears wiped away with the back of her hand. The corner of the blue fabric caught on her engagement ring. She'd stopped wearing it 3 years ago, let it sit in a drawer with the other artifacts of a life she'd been forced to abandon. She stacked the 3 sets in a neat pile and walked upstairs. Her locker was on the 3rd floor, in the nurse's station she'd moved through invisibly for 3 years. She removed everything, her jacket with the faded ranger patch sewn into the lining so carefully that no one would ever know it was there, a photograph of her parents who believed she worked a quiet hospital job and didn't know about the medals in a storage unit 30 minutes south, her personal stethoscope, a card the pediatric nurses had signed when she'd started that she'd never shown anyone. Her badge deactivated at 18:47 hours. The electronic confirmation came through her phone like a final sentence. She was no longer authorized to enter Oak Creek Memorial in any capacity. The system would deny her at the entrance. Her electronic medical records access was revoked. Her payroll account would process her final check. She existed in this place only in incident reports and altered records, in the narrative Dr. Ashford had written about her incompetence and insubordination. She walked through Oak Creek Memorial one final time at 1900 hours, her footsteps echoing on tile she'd walked for 3 years. The fluorescent lights hummed their familiar exhausted hum. The ventilation system pushed recycled air past her face. She moved like a ghost through a place that no longer recognized her as existing. Past the nurse's station where colleagues pretended not to see her. Past the break room where her coffee mug still sat on the shelf. Past the surgical wing where Ashford was briefing the board on dangerous personnel issues and documented scope violations. Out the front entrance into Jacksonville, humidity that hit her like a physical force, like the air itself was trying to push her away from this place. Behind her, she didn't hear the rotors yet. Didn't hear the heavy chop-chop-chop of the CH-47 Chinook helicopter approaching from the east, inbound at 200 feet, carrying Marines in dress uniform and Navy SEALs in full ceremonial blues. Didn't hear Webb's lieutenant commander making one final phone call that ended with a voice so quiet it was almost a prayer, "I found her. Get everyone there now." She was already gone, walking toward the parking lot where her car waited under the harsh sodium lights, already disappeared into the night the way she'd learned to disappear 3 years ago when the world had decided that honor and insubordination were the same thing. What happened next changed everything. The CH-47 Chinook landed in Oak Creek Memorial's north parking lot at 0600, its dual rotors shaking windows on 3 floors, a sound like thunder deciding to stay. 2 Marine officers stepped onto the rain-slicked asphalt, their dress blues immaculate, their bearing the kind that made security guards straighten their spines without knowing why. They walked past the front desk without checking in, past the volunteer station, directly toward the administration floor. The older one, lieutenant commander with silver oak leaves and a presence like a tank idling in a garage, held a folder. The younger, a captain with eyes that had seen things, moved half a step behind. They asked for her by a name nobody at Oak Creek had ever used. Major Ross. By any name she's using now. The hospital went quiet the way hospitals only do when something institutional has shifted. Security called upstairs. Ashford was in his office reviewing the incident report he'd filed, the one that documented her unauthorized practice, her scope violation, her dismissal from a profession that had already taken everything. His phone rang at 0603. By 0607, he was standing in the hallway watching 2 officers in dress uniform walk past his office as if he were furniture. They went to room 314 first. Lieutenant Marcus Webb was awake for the first time in 37 hours, his lung re-expanded, his breathing steady, the color returning to skin that had been the shade of old newspaper. His eyes tracked the officers the way a sailor's eyes track a ship on the horizon, recognition, relief, the sudden understanding that rescue had coordinates and a timeline. The lieutenant commander pulled a chair close to the bed. Webb spoke for 18 minutes. His voice was raspy, but his account was precise: who had saved his life, how they'd done it, what equipment they'd improvised, the fact that they'd worked with the efficiency of someone who'd done this before, someone trained, someone who knew exactly where the chest wall weakened under pressure. Someone who'd been exactly what the emergency needed. The lieutenant commander wrote nothing down. He simply listened, his expression unchanging, the way men with clearances listen to information that confirms what they've already suspected. By 0632, they were in Ashford's office. The folder landed on his desk with the weight of a sentence. Inside, Danielle's military personnel file, 8 years compressed into paper and photographs. Bronze star with Valor. The citation read like a mission brief: leadership under fire, 17 surgical interventions in austere combat conditions, preservation of life when protocol said preservation of order. Purple Heart, first one in 2014, second one in 2015. Combat Medical Badge. A photograph of her in army dress uniform from Beijing, 2013, her jaw set like someone who'd already accepted that some prices couldn't be calculated in advance. Major Danielle Ross, the lieutenant commander, said, each were deliberate. 75th Ranger Regiment, attached to JSOC Task Force Sierra. Your chief surgeon. The same woman you attempted to fire yesterday for performing emergency medical intervention with exactly the skill set the United States Army trained her to execute. Ashford's face had gone the color of institutional walls. She saved Lieutenant Webb's life using an improvised chest seal in a tension pneumothorax. The same life-saving technique she performed on 6 other personnel in Sangin Valley. The same technique she holds a Bronze Star for. The lieutenant commander leaned forward slightly, his presence suddenly less like furniture and more like weather. Sir, you tried to end the career of a decorated field surgeon for doing exactly what we trained her to do. What exactly were you thinking? Ashford opened his mouth. Closed it. The silence lasted long enough that the hum of the building became audible, the ventilation system, the distant beep of monitors, the sound of a hospital continuing to function while something fundamental had cracked in its hierarchy. Her credentials were verified, Ashford said finally, his voice smaller. She's listed as an RN. Not a physician. She's Major Danielle Ross, the captain said quietly. His voice like a door closing. That supersedes everything else in this room. The Federal Review began that afternoon. The Joint Commission arrived with forensic accountants and medical auditors who understood how to read the difference between a chart and a confession. They pulled 14 files. Room 209, the sepsis case Danielle had documented, the timestamps proved the story. Original antibiotics ordered at 1847. Chart altered at 2304 to show 2115. The patient dead by 0300. Surgical error hidden behind altered times. 3 other cases followed the same pattern. A patient with post-op bleeding marked stable on revised charts, dead within hours. A complication Ashford had caused, then erased, then allowed to kill the person whose complications he'd minimized. The hospital suspended him by week 2. The board voted to place his medical license under review. The Jacksonville Times ran the story on the front page: Chief Surgeon suspended after malpractice investigation. Whistleblower identified as decorated military officer. Ashford's photograph ran next to Danielle's from her military file, him in his white coat, looking down, and her in dress uniform, looking directly at the camera with the kind of calm that comes from having already survived the worst. The story noted that he had attempted to suppress her testimony by firing her. That the investigation had been triggered by military personnel who recognized her identity. That 17 patients in Sangin province had lived because of her decisions under fire, and that 14 patients at Oak Creek Memorial would never know that their cases had been sacrificed to protect one man's reputation. Week 3, the hospital board held an emergency session. The chief of staff resigned. The hospital administrator called Danielle personally, offering her the position of Director of Emergency Medicine with a formal apology typed on hospital letterhead. She declined in 2 sentences: I appreciate the offer, but I've accepted a position consulting for military medical training programs. Some of us are called to serve in different ways. Month 4, Ashford's medical license was surrendered voluntarily to avoid criminal prosecution for chart alteration and gross negligence. His wife filed for separation. His savings evaporated into legal fees. His settlement was simple: walk away quietly, accept whatever employment he could find, and sign away his right to ever practice medicine again. He accepted a position as night security at Oak Creek Memorial. 6 months later, Danielle stood in the rose garden of the White House in army dress uniform, the fabric slightly altered to fit the body that had carried her through the years between wars. The Bronze Star hung at her chest. The Purple Hearts hung beside it. The president stood to her left, speaking words written by staffers who had researched Sangin, interviewed the 17 men she'd saved, built a narrative of heroism that made her sound larger than she felt. The Presidential Citizen's Medal was heavy, suspended on a ribbon, placed around her neck by hand she'd only seen on television. Major Ross represents the thousands of quiet heroes who walk among us, rebuilding lives with the same courage they showed in uniform. Camera flashes. Polite applause. The moment that broke her composure came after, during the private reception, when Lieutenant Webb approached in full dress blues, walking without assistance, his chest fully healed, his eyes clear. Behind him stood 3 other men from Sangin, grayer now, some with families, all alive because of 17 hours of surgery she'd performed while her own spine was fragmenting. "I've spent 3 years trying to find you," Webb said. His voice cracked on the second word. "To say I'm sorry. You walked into that ambush to pull me out. I had to tell them you disobeyed orders because they asked me a direct question under oath. I destroyed your career to tell the truth." Danielle took one measured breath, the composure habit so ingrained it was automatic. Then she broke her own pattern. "You told the truth. That's what I would have ordered you to do. I don't regret Sangin." That night, the ceremony aired on 3 networks. In Jacksonville, the overnight staff at Oak Creek Memorial watched on the break room television. Ashford was working night security, sitting at the desk in the lobby when someone turned up the volume. The president's closing words came through tinny speakers, "Heroes walk among us. Sometimes in scrubs, saving lives in the dark." Major Ross reminds us that service doesn't end when the uniform comes off. It simply changes form. The camera showed Danielle standing beside Webb, both in dress uniform, both looking uncomfortable with the attention but standing straighter together. Ashford stared at the screen until someone changed the channel. He returned to his security logs, checking IDs and monitoring doors in a building where his name was now used as a cautionary tale in HR training about abuse of power. The faded Ranger patch from her jacket lining was framed and displayed in the West Wing Military Liaison Office, labeled Major Danielle Ross, 75th Ranger Regiment, Sangin Province, 2013 to 2015. A symbol of the identity she'd hidden and the service that had never truly ended. Heroes walk among us. Sometimes in scrubs, saving lives in the dark. And sometimes, they stand in gardens wearing medals, finally recognized, finally free. Subscribe for more stories of quiet warriors who rebuild in silence. Like and comment if you've ever been underestimated by someone who didn't know your true value.